The broadcast is now starting. All attendees are in listen-only mode.
Good morning, and thank you for joining our webinar, Nutrition for the Person with Cancer. My name is Lisa Paciuti, and I'm an oncology social worker here in the Carol G. Simon Cancer Center at Morristown Medical Center. Today's presentation will be in listen-only mode, but you can ask questions via the question box on the webinar toolbar at any time. We'll gather the questions throughout the program, and we'll answer them at the end of the webinar. This webinar, Nutrition for the Person with Cancer, will be presented by two of our oncology dietitians, Doreen O'Boyle and Mary Giselle Ulbrich. Let me introduce Doreen and Mary Giselle to you. Doreen completed her undergraduate education in nutrition at Montclair State University and her internship training at the College of St. Elizabeth, where she graduated with honors. Doreen previously worked in long-term care, and for the last 10 years, she has worked as an oncology dietitian at Overlook Medical Center's Carol G. Simon Cancer Center. In 2012, Doreen received Overlook Medical Center's Clinical Excellence Award. She is a member of the Academy of Nutrition and Dietetics, Oncology Nutrition Practice Group, and Dietitians in Functional Medicine. Doreen is a regular presenter at the Cancer Support Community of Central New Jersey. Mary Giselle Ulbrich is a registered dietitian who graduated from Cornell University and completed her dietetic internship at Henry Ford Hospital in Detroit, Michigan. She received a Master's of Science in Nutrition from Hunter College in New York City. Mary Giselle received her certification as a specialist in oncology nutrition when it was first established. For the past 16 years, she has been an outpatient oncology dietitian at the Carol G. Simon Cancer Center at Morristown Medical Center. There, she provides nutritional care to individuals undergoing chemotherapy, radiation, and surgery for cancer. Mary Giselle also counsels on nutrition and cancer prevention and nutrition after cancer treatment in one-to-one and group settings. Her former positions include Assistant Chief Dietitian at Morristown Memorial Hospital and Clinical Dietitian at Mount Sinai Medical Center in New York City. We're going to begin the presentation with Doreen.
Thank you, Lisa, and thank you all for joining us today. Just a reminder that every patient is different, most cancer treatments are different, and one size does not fit all. So with that in mind, I'd like to share some objectives we have for today's webinar. First, we'd like to discuss the benefits of good nutrition during treatment and why it's important. Review the basics of a healthy diet, highlight some common side effects, and provide strategies to manage eating problems during treatment. We'll also review the American Cancer Society Nutrition and Physical Activity Guidelines for cancer survivors after treatment. So what are the benefits of good nutrition during cancer treatment? Well, for one, patients feel better when they're more well-nourished. They can keep up their strength and energy, perform their activities of daily living. Maintaining your weight and your body's store of nutrients means that you're well-nourished and more able to tolerate treatment-related side effects. It's also good to be healthy and well-nourished to lower your risk of infection. And finally, after treatment, a well-nourished body can heal and recover more quickly. So what is a healthful diet? Well, it's one that includes the macronutrients, protein, carbohydrates, and fat, also water, and the micronutrients, vitamins, and minerals, all in the proper balance. A healthful diet provides a variety of foods that will give you the full spectrum of nutrients to support your body processes and your immune system. A healthy diet will also maintain a healthy weight. Weight changes are common during treatment. It's best to maintain a healthy weight during treatment, but sometimes treatments just present challenges that do affect people's ability to eat and therefore their weight. Your weight change can occur depending on the type of cancer or the type of treatment that you receive. Hormone-related cancers like breast, prostate, and endometrial cancers may cause weight gain, while many gastrointestinal cancers that affect stomach or intestines can cause weight loss. The proteins repair body tissue and keep your immune system healthy and functioning. All the cells in your body are made up of protein, so we do want to make sure that you get enough and restore when needed. When the body doesn't get enough protein, you're less able to fight infection. And that can be a problem during treatment, as the chemotherapy and radiation can affect your immune system. People with cancer often need more protein than usual. Surgery, chemotherapy, and radiation can cause stress and require more protein for healing. Good sources of protein are chicken, fish, low-fat dairy, eggs, and some plant sources such as beans, nuts, and seeds. If you have any difficulty meeting your protein needs, your dietitian or your doctor may recommend a protein supplement, such as a drink or a powder, to add to other foods. It's always good to check out any supplements, any protein supplements that you're using, to make sure there's not an overabundance of vitamins that may interfere with therapy. The fats provide a rich source of energy for the body and help transport and absorb fat-soluble vitamins like A, D, E, and K. Fats also enhance flavor and make eating a little more pleasurable. The mono and polyunsaturated fats are generally healthier choices than saturated or trans fats. Mono and polyunsaturated fats can be found in plant oils, nuts, seeds, and avocado. Carbohydrates give the body the fuel it needs for physical activity and proper organ function. The best sources are the complex carbohydrates that are found in fruits, vegetables, and whole grains, because they not only provide phytonutrients, but they provide fiber. And sometimes constipation is a problem during treatment. It helps to get more fruits and vegetables and fiber in the diet. Water, of course, is vital to health. All cells need it to function. And not taking in enough fluids, especially during treatment, can lead to dehydration. It can be difficult to eat a balanced diet that provides all the necessary vitamins and minerals when treatment has side effects. Your doctor or dietitian may recommend a daily vitamin to provide about 100% of the recommended daily value. It's not recommended to supplement iron unless your doctor recommends it. So many people ask, well, what should I eat during treatment? The current recommendations favor a plant-based diet that may include lean meats and low-fat dairy foods. While a vegetarian diet is a healthier alternative to the typical Western diets in general, there's no clear evidence that it's more advantageous or protective against cancer than a mostly plant-based diet. A variety of brightly colored fruits and vegetables, whole grains, fish, chicken, as well as beans, nuts, and tofu can generally provide a good, healthy diet, even during treatment. The next question, of course, is what can I eat? It's not always possible to follow these recommendations during cancer treatment. As I stated before, the priority is to maintain your weight and get enough calories and protein to support your body and its functions. Weight loss and muscle loss during treatment can be the first sign that you're not eating enough. If your body begins to use its energy sources, you'll notice some muscle weakness aside from weight loss. And generally this means you need to add to your diet, and that's where your dietitian can help you with ideas and suggestions. Generally, herbs, teas, and by that I mean exotic teas and extracts, are generally not recommended during cancer treatment. Some of the teas, though they may seem natural, might contain some herbs and things that do affect things like blood clotting. And so it's best to check out any herbs, teas, extracts that you're planning to take that you haven't taken before, especially with your doctor or dietitian. Many may be perfectly safe, but some may interfere even with your cancer treatment. Unfortunately, a lot of these supplements are not standardized, so you don't always know the source of the herb, the strength of the herb or extract, or even how much active ingredient it contains. So this is always best to discuss with your doctor or your treatment team. Preparing for treatment may mean preparing for surgery, chemotherapy, or radiation, and frequently a combination of all three. So you may have experienced weight loss related to your cancer. It may have been the first sign that something was wrong. But it can leave you debilitated even before treatment begins. So your medical doctor or surgeon may want you to build up your reserves before surgery or chemotherapy, just to prepare in case there may be some challenges ahead. As I said before, one size does not fit all. Although many chemotherapy agents work in similar ways, not everybody will have the same side effects. We say how you eat depends on how you treat, because there are individual concerns with each patient and each treatment. Did you lose weight prior to diagnosis or have surgery which affects your ability to eat? Do you have other health conditions, or do you take medications which may require dietary restrictions? If you're confused about what to eat or are overwhelmed by nutrition advice from well-meaning friends and family, a registered dietitian, who is also a certified specialist in oncology, can help you make sense of some of the information you may have heard and provide a balanced and evidence-based recommendation for your particular needs. With that, I'd like to turn it over to my colleague, Mary Giselle, to give us a better idea of how to specifically deal with some of the side effects experienced during treatment.
Hello, and thank you again for attending this presentation. And thank you, Lisa, for moderating. Doreen, you gave a wonderful, informative discussion, and now we will continue to speak about the management of nutrition-related side effects. As Doreen said, maintaining good nutrition is important during cancer treatment, but many times treatment can affect your ability to meet your nutritional needs during treatment. We'll go over the following symptoms that can affect your nutritional intake: poor appetite, constipation, diarrhea, sore mouth or throat, nausea, vomiting, taste or smell changes. Poor appetite can be caused by chemotherapy, radiation therapy, fatigue, emotional stressors, and pain. Many times, if we address the cause of the poor appetite, appetite can be improved. I like to tell people that you should be thinking of snacks and not meals. Keeping easy to prepare foods available will help you. Bring snacks with you wherever you go so you don't miss a meal. Another idea is to prepare meals in quantity when feeling well. Asking people or having people offer to cook for you is also helpful if you're feeling tired. Use ready-to-serve medical nutrition products for convenience and extra nutrition if you're having trouble meeting your nutritional needs. Things such as Ensure or Boost, Boost Plus, Ensure Plus, Scandi Shakes, all of these they come in individual packages and can provide and be adjusted to different nutritional needs for different people. I mentioned snacks, and these are some quick and easy snacks to have around or to make. Homemade milkshakes and drinks, and a lot of times I tell people that you can mix the Ensure or Boost with ice cream, and that's easy to sip. It's a lot easier to drink if you have a poor appetite than to eat. So we suggest that you drink healthy, high-calorie fluids if this is an issue. Whole or half sandwiches such as egg salad, grilled cheese, peanut butter, cold cuts such as turkey breast can also be helpful. Sometimes a half a sandwich is a little bit more appetizing than a whole sandwich. Cookies, which is one of my favorites, ice cream, sherbet, frozen yogurt, soups, either broth-based or hearty soups, cheese and different types of cheese, and angel food cake. More of the quick and easy snacks that you should keep around are Jell-O, popcorn and pretzels. Cereal can be a snack. You don't have to eat it for breakfast. Granola and trail mix, puddings, custards, vegetables, perhaps with dips, eggnog, muffins, low-fat or regular green yogurt, any type of fruit, nuts, seeds, crackers, juices, sports drinks, dips, and milk. It depends on how you're feeling and what your particular issues are with nutrition. So some of the foods that I mentioned may not be applicable during certain times. So constipation can be caused by pain medication or some of the other medications used to work with side effects of the chemo or radiation or surgery. For constipation, we suggest that you use high-fiber foods. High-fiber foods include high-fiber cereals, which include cereals that are 4 or more grams of fiber per serving. Certainly fruits and vegetables, preferably with the skins. Legumes such as split peas and lentils. Some of the higher fiber vegetables and fruits are broccoli, cabbage, cauliflower, carrots, potatoes with skin, and peas. Some of the more high fiber fruits are blueberries, strawberries, apple with skin, pear with skin, and oranges. It's important to drink plenty of fluids to be hydrated and also to soften the stool. Keep physically active if you are able. Anything you can do to move the lower half of your body helps stimulate the bowel. It's a good idea to avoid or limit gas-forming foods and beverages such as carbonated beverages, broccoli, cabbage, cauliflower, the healthy ones that I recommended. But drinking lots of fluids and getting the exercise does help with managing gas problems. The opposite of constipation is, of course, diarrhea. We suggest that you eat small, frequent meals or snacks of low-fat, low-fiber foods. I'm not sure if anybody is familiar with the brat diet, but it consists of bananas, rice, applesauce, and tea, or toast. It's very important to replace fluids, but also electrolytes. Sports drinks are very helpful in doing this, and you actually get better hydrated with sports drinks with the electrolytes. That also makes you feel less tired. Choose white foods, white rice, white potatoes, white bread, white noodles. These are generally considered foods that are not as healthy as high fiber foods. It does help. This is symptom management, and it does help with managing the symptoms. You would like to avoid fresh fruits and vegetables during this time, and avoid acidic and spicy foods. Acidic foods include those that contain tomato, citrus, or vinegar, and spicy foods include individual spices as well as condiments, such as mustard and ketchup. If you have a sore mouth or throat, it makes it difficult to swallow foods. You want to select cool, smooth, moist foods, such as casseroles or soups or stews. You can sometimes puree the foods if you're having trouble with lumps or swallowing harder foods. Using a straw can help make swallowing easier as well. Avoiding, again, the acidic, spicy, and dry foods. Crunchy foods might be irritating, such as crackers or pretzels or nuts or raw fruits and vegetables. Using high-calorie drinks and or medical nutritional supplements can also help supplement your diet. A common side effect is also nausea and vomiting. Diarrhea and nausea and vomiting both are results of an irritated gastrointestinal system, and so they are usually treated the same way. Avoiding greasy, fatty, or spicy foods. Avoiding strong food odors. Sometimes sitting in a well-ventilated area, and avoiding food odors by grilling outside or using a microwave instead of a stove or oven can help decrease food odors. Avoiding very sweet foods. Cool foods are usually tolerated better than hot foods. Avoid drinking liquids with meals. Drink your liquids between your meals so you don't feel so bloated. Sitting up for about an hour after meals is helpful because gravity is working to keep the food down. Avoid favorite foods around treatment time because if you eat them at that time and you get nauseous, you might have an aversion and not want to eat them again. Small frequent meals and snacks. This is the most helpful thing I find with people that are having this type of problem. So eating and keeping food in your stomach helps soak up the acid and settle your stomach. Try cold or room temperature foods, ice chips, and dry foods such as crackers or pretzels. Try avoid eating 1 hour before treatment if you find that makes a difference. Ginger products are very helpful in settling the stomach. Ginger ale, candied ginger, ginger snaps, ginger tea. Again, if you're vomiting, replacing the fluids and electrolytes. Broth, sports drinks, gelatin, watermelon, and ice pops all count as fluids. Some people experience taste or smell changes. Using tart or sour foods to reduce metallic taste can be helpful, but these might be a problem if you're experiencing other GI symptoms such as nausea, vomiting, or diarrhea, or sore mouth. Season foods with herbs and condiments. Serving foods cold or at room temperature have less taste, and sometimes blander foods are better tolerated than spicier foods. With a metallic taste, try using plasticware instead of metalware, or using glass or plastic containers rather than cans or metal containers. Food safety is important to help protect against infection. When eating out, avoid street vendors, salad bars, and buffets. Using separate utensils and cutting boards when preparing cooked and uncooked foods. Refrigerate perishable foods within 1 hour. Keep hot foods hot and cold foods cold. Avoid expired foods. Throw out your leftovers after 2 or 3 days. Wash your hands for 20 seconds with hot soap and water before and after preparing food. And if you say the alphabet twice or sing happy birthday twice, that is 20 seconds. Keeping hot foods hot above 140 degrees Fahrenheit and cold foods cold below 40 degrees Fahrenheit in the refrigerator. Washing produce well under running water before peeling or cutting is helpful. Using a food thermometer, you cook meat to 160 degrees and poultry to 180 degrees. We've talked about nutrition during treatment, and I'd like to go over some information about what we suggest with recommendations for the American Cancer Society. These are guidelines that were developed first in 2006 and then revised again in 2012, and they are working on them again. One of the primary things that we recommend is to achieve and maintain a healthy weight. 10 cancers have been linked to overweight and obesity: liver cancer, ovarian, colorectal, postmenopausal breast cancer, advanced prostate cancer, endometrial cancer, esophageal, kidney, pancreatic, and gallbladder cancer. Now, obesity and sedentary lifestyles risks are the new tobacco risk. Tobacco and smoking used to be the cause of a lot of other cancers, many cancers, but obesity now is far ahead as a risk factor. The prevalence of overweight and obesity in the United States between 2007 and 2012 is for men, 35% of men are overweight, 39% are obese. For U.S. women, it is 29% of overweight and 36% obese. So the number of obese adults now eclipses those who are only overweight. Obesity and risk of cancer. What these numbers really mean is that getting to and staying at a healthy weight could prevent 320 cases of cancer each day. The American Institute for Cancer Research estimates that carrying extra body fat will cause approximately 117,000 cases of cancer in the United States this year. If you are overweight or obese, we suggest that you limit consumption of high-calorie foods and beverages and increase physical activity to promote weight loss. Engage in regular exercise, and you need to speak with your doctor about this, but you are not too heavy to exercise. A lot of things might interfere with certain types of exercise, but strength training, aerobic exercise, and balancing exercises are helpful. They help promote adequate weight loss as needed and improve bone health. So speak with your doctor about what kinds of things he would or she would like you to do. Exercise does help improve quality of life, fatigue, psychosocial distress, depression, and self-esteem. Again, improvement in lean body mass, bone mass, and muscle strength. Increases in lean body mass help increase the metabolic rate, which is the rate which helps you burn calories. It also may decrease the development of some of the hormonally related cancers such as prostate, endometrial, breast, and colon cancers. And again, remember to check with your physician before making any changes to your lifestyle. You want to eat a rainbow of foods. Achieve a dietary pattern that is high in vegetables, fruits, and whole grains. Choosing foods and drinks in amounts that will get you to maintain a healthy weight. Basically, we're talking about portion size. Using large plates, believe it or not, helps fool you into thinking that you're eating more than less. Eat at least 2.5 cups of vegetables and fruits each day. And that's really not a whole lot if you make it a goal of trying to eat fruits and vegetables, 1 serving per meal or snack. Limit how much processed food, such as meats and red meats, that you eat. Again, portion control. This is a very good graphic. Instead of trying to weigh things, you change the proportions of food that are on your plate. So that half your plate is fruits and vegetables, 1/4 are whole grains, such as brown rice, whole wheat pasta or whole grain pasta, quinoa, and barley. And then the protein should be about 1/4 of your plate. And that can also include animal products and beans to provide protein. To sum it up, quick tips for good nutrition for cancer survivors: achieve and maintain a healthy weight. Try to avoid gaining or losing weight during treatment. Drink the recommended amounts of healthy fluids each day, such as water, juice, milk or milk substitutes to meet your fluid needs. Be vigilant with food safety concerns. Pay attention to food sanitation, food recalls, and food preparation methods. It would be helpful to address any eating related issues that prevent you from maintaining a healthy weight. It's a better idea to talk to your healthcare team before it becomes a problem and find out what to expect and how to deal with those issues. Be physically active every day. Talk to your doctor about recommended activities for maintaining your muscles and strength. The recommendation is for 30 minutes of exercise most days of the week, or 150 minutes of exercise per week. Some of the references and resources that I used are from the American Cancer Society. They have some publications, one of which is called Nutrition for the Person with Cancer. The other one is Lifestyle Changes That Make a Difference, that focus on survivor guidelines. The American Institute for Cancer Research has more information about the individual types of cancers and how they are affected by different factors. Memorial Sloan Kettering Cancer Center, their integrative medicine website is very helpful in looking up things about herbs and extracts and teas and other alternative or complementary treatments. The National Cancer Institute is also a helpful resource. Some of the references, things that are books that might be helpful: Nutrition in the Cancer Survivors, Eating Well, Staying Well During and After Cancer, which is published by the American Cancer Society, the Essential Cancer Treatment Nutrition Guide and Cookbook, and the Cancer Survivor book that talks about quick and easy recipes. More are from the American Academy of Nutrition and Dietetics, the Oncology Nutrition Dietetic Practice Group, of which our nutritionists from Morristown Medical Center and Overlook Medical Center are both members of. We were all certified as well in specialists in oncology nutrition. And in terms of resources for food safety, the American Department of Agriculture Food Safety and Inspection Service. Thank you for your interest. We are Doreen O'Boyle and Mary Giselle Ulbrich, and I'm going to turn it back to Lisa for a minute.
Thank you, Mary Giselle. And thank you, Doreen. There was so much great information. I'm glad you can see it all up on the slides. We had some questions that came through. So I'm going to hand the microphone back to Mary Giselle to go over the questions and answer them. All right?
Thank you, Lisa. I see that we've got a question that we see constantly. People are always asking, does eating sugar and sugar-containing foods, does it feed the cancer? Now, sugar has not been shown to directly increase the risk or progression of cancer. However, sugar and refined sugars, including honey, raw sugar, brown sugar, high fructose corn syrup, and molasses, and sweetened beverages such as sodas and sport drinks and punches, containing large amounts of sugar add substantial amounts of calories to the diet. Many times these high sugar foods are also involved with they're included and added to dairy products and baked products, which can increase the calories even more. High-calorie foods can promote weight gain and lead to obesity, which can adversely affect cancer outcomes. These beverages that are high in sugar have been shown to lead to higher blood insulin levels. Researchers are very interested in whether over-consuming refined carbohydrates, higher insulin levels, obesity, and insulin resistance may indirectly increase the cause of certain cancers. Most of the foods and beverages that are high in added sugar do not contribute as many nutrients to the diet and often replace more nutritious foods. Therefore, limiting your consumption of foods and beverages with refined sugars and carbohydrates may help reduce the risk of cancer. Okay, Lisa's giving me another question about organic foods. This is probably the second most popular question that we get. Now, the term organic is often used for foods grown without pesticides and genetic modifications. It's also used for meat, poultry, eggs, and dairy that come from animals that are not given antibiotics or growth hormones. It is commonly thought that organic foods may be better for you because of less chemical exposure, and it is also suggested that nutrient makeup may be better than non-organic foods. But at this time, there are no studies in humans to show whether organic foods are better than conventionally grown foods in terms of reducing the risk of cancer, the risk of cancer coming back, or the risk of cancer progression. Most experts agree that it is more important to eat fruits and vegetables and that the benefits outweigh the risks of high pesticide intake. The last question that we have here is about eating soy foods and if they are harmful. Soy foods are an excellent source of protein and can be a good option for vegetarian meals. We would want people to go more towards a plant-based diet. Soy contains many phytochemicals, which is another way of saying plant chemicals, some of which have weak estrogenic activity and may actually seem to protect against some hormonally dependent cancers in animal studies. Other compounds in soy may have antioxidant properties and other cancer-reducing effects. There's a great deal of interest in the possible role of soy foods in reducing cancer risk, such as breast cancer and prostate cancer. For breast cancer survivors, current research finds no harmful effects from eating whole soy foods such as edamame, tofu, and soy milk. It is suggested to avoid soy powders or soy isoflavone pills. Well, I think we're out of time now, and I think it's time to wrap up. I'm going to hand you back to Lisa, and once again, I want to thank you for your attention and your interest in attending this webinar.
Again, many thanks to Doreen and Mary Giselle. That's the end of our program today. Later on, you'll receive a follow-up email. Please use it to send us your comments or feedback on today's program. And thank you for joining us.